Good morning, everybody. Hope all of you are safe at your home and enjoying the text. Let's discuss general pharmacology. Listen, my dear, disease is a part of society, disease is a part of human life, and disease is a part of human civilization. When we are talking about a disease, we must talk about a drug. Listen, my dear, drug, by definition, drugs are not only intended to cure any pathological state or any disease, it also aims to prevent the disease, and drugs are also helpful for the diagnosis of a particular disease. That is according to WHO, World Health Organization, the exact definition of the drug, which is not only merely intended for cure but also for prevention and to diagnose a particular problem. Let's give an example of diagnosis substance. All of you know you are taking the drug for the purpose of cure. All of you know you are taking a drug for the purpose of prevention. For example, now world is trying to make preventive vaccines for corona. That vaccine will treat for the prevention of corona. Then I am giving another common example, tetanus toxoid, TT, common TT. When you are having certain type of cough, you are taking TT. That is for preventive purpose. Then what is diagnosis purpose? It is starting. Still I am giving you examples. Phentolamine is a drug. That phentolamine drug is given for the diagnosis purpose of pheochromocytoma. Pheochromocytoma, a particular type of tumor, exists due to overactivity of adrenal medulla, hypersecretion of adrenaline. From adrenal medulla, it is the tumor of adrenal medulla. In that case, phentolamine is the drug which is intended to diagnosis of that particular problem. Previously, India was the hub for herbal medicines. Means before some year, before 50 years, before hundreds of years, only herbal medicines are there. Medicines from crude drugs, from natural sources are there. Slowly science develop and new drugs are from synthetic or chemical sources discovered which helpful for mankind, and this drug has few side effects also. In general, your pharmacology can be studied under two headings. One is pharmacokinetic, other is pharmacodynamic. Here it is pharmacokinetic and another is pharmacodynamic. Let's discuss about pharmacokinetic. What do you mean by pharmacokinetic? Pharmacokinetic means what the body does to the drug. Means response of the body towards the drug or movement of the drug throughout the body. Means when you are taking a drug orally, it goes to your gastrointestinal tract, then to systemic circulation, then to other part, then to a part where it metabolizes, then finally it excretes. Means the round movement of the drug throughout the body is pharmacokinetic, or what the body does to the drug, that is known as pharmacokinetic, which can be studied under four headings: absorption, distribution, metabolism and excretion. The four headings. ADME. It is known as ADME. A for absorption, D for distribution, M for metabolism, and E for excretion of the drug. The process is a sequential process. First absorption takes, then distribution, then metabolism, then excretion. Then what do you mean by absorption? Absorption means the movement of the body from site of administration to systemic circulation. That is absorption. So, to act a drug, it needs good absorption. Then another term associated with absorption is bioavailability. The rate and extent of drug absorption is known as bioavailability, or the fraction of drug which reaches to systemic circulation is known as bioavailability. That means the drug need to reach systemic circulation and make it concentration at systemic circulation, high concentration, good concentration or peak concentration, then only the drug can act. If you are taking a drug by any means, it cannot move to systemic circulation or very poorly move to systemic circulation, that means the drug does not work. So, bioavailability is very much important in concern to drug absorption and drug action. See, I am giving a graph. This is suppose time and this is plasma concentration of the drug. X-axis and Y-axis, X-axis time, Y-axis plasma concentration. And this range is known as therapeutic range. Okay, see, I am giving 3 drugs. It is A drug, it is B drug, and it is C drug. Among A and B and C, see, this drug A does not reach the therapeutic range, very poor bioavailability, action ठीक से नहीं होगा. This drug B apparently reaches the point of therapeutic range, and this drug C reaches therapeutic range up to therapeutic range, means having good bioavailability. That means the drug need to reach systemic circulation properly and maintain concentration of systemic circulation, which is known as plasma concentration of the drug in plasma. That must be done, then the drug will work. Okay, then here some factors that responsible for good absorption is the aqueous solubility. It is very important for oral drug. If you are taking oral drug, the drug must have aqueous solubility. The drugs are designed in that manner. Then another concentrations. Okay, then the most important thing is that area of the observing surface. Yes, area of the observing surface. It is immense important. If the area of observing surface is more, the absorption is good, the bioavailability is good, ultimately the action of the drug is good. Take an example of orally drug, stomach and intestine. In between stomach and intestine, the surface area of intestine is much more. That's why the absorption of drug is in intestine is very good. Another term associated with this, I am telling you, fast pass metabolism. The term is fast pass metabolism. See, metabolism is a process in movement of the drug in pharmacokinetic process. But that process comes in third stage. This stage, first absorption, then distribution, then metabolism. Then what is the definition? Fast pass metabolism. Fast pass metabolism, immediate metabolism. Meaning before coming to third step, drug get metabolized from here. That is known as fast pass metabolism. Let me clear it. See, stomach. Suppose it is the stomach. Here is the drug. It has a tablet or anything. It's a drug. Oral drug, from here it need to go to here. It is SC, systemic circulation. मैंने पहले भी बताया, drug need to go to systemic circulation for work, where it maintain plasma concentration. Any oral drug you are taking, tablet, capsule, etc. from stomach, it moves to systemic circulation. Then after systemic circulation, another process start distribution, then metabolism. But some drug, few drug, what they do? Instead of going to systemic circulation, they move here. Means they move to liver via portal vein. Portal vein, P-O-R-T-A-L, portal vein, through portal circulation. Drug, instead of going to systemic circulation from stomach, moves to liver through portal vein via portal circulation, where it get metabolized. Because liver is the storehouse of enzyme. So after initial absorption, after the process of absorption, instantly drugs move to liver through portal vein and get metabolized and get altered. Then there is no good action, means there is no good bioavailability of the drug due to fast pass metabolism. So those drugs which undergo fast pass metabolism, their oral dose is not encouraged. If you give oral dose, then from here they move to liver and undergo fast pass metabolism. So one drug is penicillin. Its oral dose is not effective due to rapid fast pass metabolism or high fast pass metabolism. So it needs to make the drug in parenteral form, direct injected form. So stomach bypass and portal vein, movement of portal vein bypass, the drug may act. It is one term. Then comes to the term distribution, which is important and second step. Drug distribution is the second step. Okay, in distribution, okay, through the passage of blood, through the circulation process, drugs distributed and drugs redistributed. Okay, in concern to that distribution, there are two junctions. One is tight junction, other is leaky junction. See, it is a tight junction. There is no intracellular post-tight junction. Only lipid soluble drug can enter because these membranes, these capillary membranes are liquid and lipid soluble drug dissolve and cross. Tight junction. Another junction is leaky junction. In leaky junction, what happens? There is intracellular pores. Intracellular pores. Aqueous soluble drug or water soluble drug, they pass through intracellular pores. But aqueous soluble drug, they cannot pass through that junction. That is tight junction. Okay, another term associated with drug distribution is plasma protein binding, which is very much important. Drug need to bind to plasma protein tightly. Okay, in that concern there are two concepts. One is bound drug, other is free drug. The fraction which bound to plasma protein, it is known as bound drug. The fraction which bounds to which free, it is known as free drug. For example, from a drug 20 mg, 10 mg is bound to plasma protein, it is bound drug. Another 10 mg is free, that is free drug. Okay, then there are two types of plasma protein. One is albumin, another is alpha 1 glycoprotein. First is albumin, another is alpha 1 glycoprotein. Okay, so in general there are two categories of drug: acidic drug and basic drug. Okay, acidic drugs are bound to albumin, acidic drug, and all basic drugs are bound to alpha 1 glycoprotein. Means the drug which nature is acidic, they must bound to albumin, and the drug which nature is basic, they must bound to alpha 1 glycoprotein. Here some concepts of some barriers are there: placental barrier, blood-brain barrier, blood CSF barrier. Okay, all drugs, they cannot cross placental barrier or some blood-brain barrier or blood CSF barrier. The nature of the drug, the quality of the drug to cross that barrier is that they should be lipid soluble, because in that area you will find a tight junction. Only certain lipid soluble drug can pass through that barrier. Then comes to the important point, that is metabolism. In short, I am telling you metabolism. Metabolism means chemical alteration of the drug or biotransformation of the drug. Here